Right, today we are going to get our heads around the really complex subject of brain tumors. We're going to look at what they are, how they're treated, and maybe most interestingly, some of the really unexpected and indirect ways they can mess with the body. Okay, let's kick off with what is, without a doubt, the single most important fact you need to grasp. Honestly, this one sentence completely flips the whole conversation on its head. See, when you hear brain tumor, you naturally think it's a cancer that grew in the brain. But believe it or not, most of the time, that's just not where the story began. So, to make sure we're all on the same page, doctors basically split tumors found in the brain into two main camps. And it all boils down to one very simple question: where did it come from? So, on one side, you've got what are called primary brain tumors. The best way to think of these is that they're homegrown. They're neoplasms, which is just a fancy word for new growths, and they spring up directly from the brain tissue itself or from its protective wrapping, the meninges. And this table just lays it out perfectly. You've got your primary tumors like gliomas and meningiomas, which are born and bred in the brain. But then you have metastases. These guys are the invaders. They're actually the more common type, and they come from a cancer somewhere else entirely, like the lung or the breast, that has basically packed its bags, traveled through the body, and set up a new outpost in the brain. Okay, so if we focus on those homegrown primary tumors for a minute, how do doctors actually know how serious one is? Well, they use a really simple but absolutely crucial ranking system to grade how aggressive it is. It's a pretty straightforward scale from 1 to 4, put together by the World Health Organization. Grade I is benign. That means it's the slowest growing, the least aggressive. And then as you climb the ladder, the tumor cells get more and more abnormal. They reproduce faster and faster until you hit grade 4. And that's highly malignant, the most aggressive and fastest growing of them all. Now have a look at this. This chart breaking down the primary tumors is pretty eye-opening. Just look at that massive chunk for gliomas. They make up a staggering 60%, and they're typically the malignant kind. It just shows you how much they dominate the landscape of primary brain tumors. And here we've got an MRI scan of the most common benign type, a meningioma. Now, if you look really closely at the image, you can see that bright white mass isn't actually growing inside the brain tissue, it's on the outside, pushing in. It's growing from the meninges, those protective layers we mentioned a moment ago. Right, let's jump from one end of the spectrum to the other. So we've seen the most common benign one. Now let's look at the top of that WHO scale. At the most aggressive grade 4 tumor there is, it's called a glioblastoma multiforme, but pretty much everyone just calls it GBM. GBMs can look really distinctive on an MRI, and honestly, pretty unsettling. Sometimes the tumor will spread right across the two halves, the two hemispheres of the brain. When it does that, it creates this eerie, symmetrical shape that's earned it the rather grim nickname, the butterfly glioma. You can see why. So this all begs a massive question, doesn't it? How would anyone even have a clue that something like this might be going on? Well, the body does have its own warning system, but the exact signs you get depend almost entirely on where the tumor is and how big it's getting. You see, the main red flags are all about the physical space the tumor takes up. It's growing inside the rigid box of your skull, which increases the pressure, and that can cause really bad headaches and vomiting. Or it might start pressing on a specific part of the brain and interfering with its job. That causes what doctors call focal deficits, which just means specific problems like weakness in an arm, trouble speaking, or changes in vision. Seizures are also a big warning sign. Now, this next point is really, really important to take on board, which is why we've pulled it straight from the source. Just having a simple headache that doesn't change on its own is very, very unlikely to be a brain tumor. The kind of headache that makes doctors concerned is one that keeps getting worse, is particularly bad in the mornings, or comes with some of those other neurological signs we just talked about. So to actually get a clear picture of what's going on, there is one go-to tool that is head and shoulders above the rest. The gold standard, the investigation of choice, is an MRI scan. And they use a special contrast agent. It's basically a dye that you're given before the scan that makes any tumor light up bright white, making it impossible to miss. Okay, so the MRI confirms it. There's a tumor. What's the plan of attack? Well, the medical world has a pretty clear, multi-pronged strategy. The treatment is usually a full-on assault from multiple angles. First up, surgery, to get as much of the tumor out as is safely possible. Then radiotherapy, which blasts any leftover malignant cells with high-energy rays. Third is chemotherapy. For nasty tumors like GBM, a drug called temozolomide is the standard. And that last one, medical therapy, that's a bit different. Things like steroids aren't there to fight the cancer itself, but to reduce the swelling around it, which makes a huge difference to the symptoms. And this, unfortunately, is where that grading system becomes so incredibly critical. The outlook, the prognosis, is almost completely dictated by the tumor's grade, and the difference is just stark. For highly aggressive grade 4 glioblastoma, the median survival time is tragically short, only about a year. But for those low-grade, slower-growing tumors, long-term survival is definitely on the table.
Okay, everything we've covered so far has been about a tumor inside the skull causing problems. It makes logical sense. But now we're going to take a really weird turn, because it is possible to have all the symptoms of a brain tumor when there is no tumor in your brain at all. The real problem is a cancer somewhere else in your body, creating a kind of ghost effect.
Right, it's got a mouthful of a name, paraneoplastic neurological disorders, but the idea behind it is just wild. Imagine you have a cancer, maybe in your lung. Your immune system, quite rightly, gears up to fight it. But then, something goes wrong. The immune response goes haywire, and it starts attacking your own healthy nervous system by mistake. The key thing to understand here is that this is a case of friendly fire. Let me say that again, friendly fire. The damage to the brain isn't being done by cancer cells, it's being done by the body's own defense force. It creates these things called autoantibodies to go after the tumor, but they get confused and end up attacking healthy nerves instead.
And what's really bizarre is that this phenomenon is often linked with very specific cancers, especially small cell lung cancer. And here's the kicker. In a lot of cases, these strange neurological symptoms are the very first sign that anything is wrong. They can appear months or even years before the underlying cancer is ever found. Just incredible.
Right, we have covered a lot of ground. So, to make sure all the really crucial bits of information stick in your head, let's do a quick fire round of the main takeaways. If you only remember a handful of things from this, make it these. What are the most common brain tumors overall? That would be metastases, the invaders from elsewhere. The most common benign one that starts in the brain, the meningioma. And the most common malignant one, the glioblastoma. How do you find them? MRI with contrast. And how do you treat a GBM? With temozolomide and radiotherapy. Got it? Good.
And that leaves us with one final, pretty profound question to chew on. The fact that these ghost syndromes even exist shows that fighting cancer isn't just about killing tumor cells. It forces us to think about the incredible complexity of our own bodies. And it makes you ask, how do you fight a war when your own army can sometimes turn against you?